we didn't find much, right? So when women ask you about caffeine during pregnancy, what are the usual concerns that they usually raise to you?
So it's interesting what you're saying about your wife. So I think that's probably the most common thing I get, and I hear people saying, "Do I need to give caffeine up completely?" And I think there's so much misinformation online, and like you say, there's sometimes it's just really difficult to find any information whatsoever. So I think a lot of women feel really guilty or nervous about having coffee or caffeine in general very early on in pregnancy, and throughout the rest of pregnancy as well. But I think a lot of people feel very guilty if they've found out they're pregnant a little bit later and they say, "Oh no, I've been drinking coffee," and I think
Yeah.
it can be very confusing and overwhelming as a result.
And are there any specific guidelines, any guidance that you share with your patients, or what are them, yeah, like what are the clinical recommendations from a caffeine intake perspective?
Yeah, so I always use the NHS guidelines. I always quote them. So ideally, we want to be sticking under about 200 milligrams of coffee per day during pregnancy. There's a very good caffeine calculator on the Tommy's website. It's very easy to use, and you can just pop in how many teas, coffees you normally would have a day. Also thinking about things like, I guess, energy drinks and even chocolate has caffeine in it. So I definitely would recommend a lot of my patients to go and have a little look at that and assess how much caffeine they're having day to day. But roughly 200 milligrams is about one strong coffee or like a couple of cups of tea a day. I think when you're breastfeeding, you get slightly more leeway, but you should still keep an eye on it and not go overboard.
Okay, and in terms of why that's important be to have those caffeine limits in your radar as you're pregnant, why is that important? Why are those limits in place?
So it's mainly about the risk, reducing the risk of things like miscarriages or having a low birth weight. Um, I mean, the evidence, again, with anything, because we can't do a lot of studies on pregnant people, so the evidence isn't crystal clear, but the sort of the 200 milligram limit is a very cautious guideline, and so it should sort of you should be able to incorporate caffeine into your day-to-day life in a balanced way. But obviously, yeah, going too far over that will put you at greater risk of things like miscarriage and a low birth weight.
Sure. And are you